So thank you. Today is our second day of 30th, the 30 days of curtain raiser celebrations. We are inviting Afghanistan, our neighbor country, today to the international platform to bring their segment of homeopathy and Ifph Afghanistan. Dr. Obaidullah is there. Dr. Obaidullah, can you please raise your hand?
Yes.
This is Dr. Muhammad Kareem from Afghanistan. I think Dr. Ubaidullah al-Hashmi will be there. And because he called me that we will join at the right time, I think 7 p.m. Afghanistan Standard Time. Over to you.
Yes. Okay, it's 7 p.m. It is 8 p.m. in IST. I think it's 7 p.m. there. Might be expected. Because this is a specialty of the IFP. They are very prompt in time, at exact at 7 o'clock English, Hindi, 8 o'clock English, and at 9 o'clock the Malayalam session. There is no let up on that. That's the most important thing. As our guest from Dr. Beatrice Doctor joined. Welcome, Dr. Beatrice sister.
Please make homeo skill, Dr. Obaidullah.
Dr. Barbara, please.
Yeah.
I got online, sir.
Yeah, please come. Okay.
Yes, I got it.
Okay.
Then I shall look into.
Dr. Obaidullah is just joining. Just a minute. Those who join from Afghanistan, please go to the reactions or to the participant list, and there is a raise hand option. Please raise your hand so that we can make you the co-host.
There is
so that you can mute and unmute at your will.
888-41586. Please mention the name.
Dr. Muhammad Kareem, you are a co-host now. You can mute and unmute at your will.
Okay, thank you. I think Dr. Hashmi is there. He didn't join us.
Roins, please make Roin stroke 1, 2, 3.
We are having the Roin survey also from HMA. Roin, can you hear us?
Yes. Please make him co-host. He's there. He has joined.
I'm Roin Sarwari from Afghanistan Homeopathic Health or Medical Association.
Okay.
Dr. Barbara, Dr. Dhanesh, who is the?
Dr. Manoj, you are the host now.
Yes.
Please.
Yes.
Roin Straw. Dr. Roin Straw. A man with full suit.
Okay, but I think if we wait a few minutes for Dr. Obaidullah Hashmi, just please, so sorry for this, because he will at first introduce the Afghanistan Homeopathic Medical Association, then we will go forward about other contents, because we have distributed the contents. Because of this, I think if we have some minutes for Dr. Obaidullah, he will come. I don't know, but just we are waiting for your suggestion. Also, if you want, we can start. We will have an interview on Afghanistan Homeopathic Medical Association.
Dr. Manoj, make me a co-host.
Dr. Ikram Khan has arrived. Dr. Isamuddin is there.
Could you, Doctor? What?
Make me a co-host.
Oh, yes, of course.
IFPH Tech.
Yes.
Okay. Dr. Muhammad Kareem is there. I think homeo skill. Who can be that? Is it Dr. Obaidullah? Homeo skill, please introduce yourself.
I think you can start, Dr. Shadi Gudiyat.
Yeah. We are waiting Dr. Vaidullah to come.
And you can start some regarding some information you give.
Yeah, because, thank you. So this International Forum for Promoting Homeopathy is an organization started at the time of pandemic, when the whole world remains standstill, fearful and panic about the pandemic COVID-19, which is a viral infection. So fortunately, homeopathic medicine came out as the best prevention, treatment, and rehabilitation for viral infections, especially for COVID-19. So at present, India, and especially Kerala, a state, southern part state of India, which is one of the hub of homeopathy in the world today. And we homeopaths in Kerala are aware about it. And we initiated the formation of an organization to promote the potentials and possibilities of homeopathy around the world, so that this panic and fear about the viral infections will be eradicated. And such a fear about the COVID-19 pandemic will be eradicated. And through the use of homeopathic medicine, we will be able to effectively prevent, treat, and rehabilitate viral infections, including COVID-19. So for such a purpose, we created this organization made up of homeopathy doctors and supporters or lovers of homeopathy from around the world. We started daily Zoom meetings to educate people about it. We have 2 sessions until recently, one in English for international audience, another one is in our local language, Malayalam, for our local people in Kerala. Recently, we started Hindi session also. That is our national forum.
Yes, Dr.
To
Rajiv,
promote
Dr.
homeopathy
Excuse
nationally.
me, Dr. Obaidullah joined this. Yes.
Yeah, I have seen. You make him co-host.
Yes.
So
of
the
course.
president of Afghan Homeopathic Medical Association, a very important, passionate man who is doing a lot of work in Afghanistan. We are proud of you, Dr. Vaidullah. And he's a very sincere and dedicated person for spreading homeopathy in Afghanistan. He is very passionately connected to international forum also, always joining with all the efforts from his side to bring homeopathy to the people of Afghanistan in the best way possible. So without any delay in time, we are directly going to Dr. Vaidullah for his presidential address as the president of Afghan Homeopathic Medical Association, and also to introduce the chief guests of today so that we can proceed further. Dr. Vaidullah, over to you. Please make Dr. Vaidullah a co-host.
Yes, he's the co-host now.
Okay.
Dr. Obaidullah, please unmute. You can unmute now, please. Dr. Obaidullah, please unmute. Yes, please.
Yes, unmuted. I'm trying to connect from my computer, but the network is very down here.
Okay.
And just let me connect it from the computer. That will be much better.
Don't worry, you can proceed. Your video is visible, your audio is also okay. So
Doctor, we are already late by 10 minutes. Please proceed, Dr. Obaidullah, please.
please proceed, doctor.
Yeah, do you hear me, sir?
Because 2 systems are on, there is an echo of 1.
Yes, just I'm leaving from my phone. I just leave from my phone. No,
Okay.
I'm from one system right now. Am I audible, sir?
Okay.
Yes. One word, one health, win with homeopathy. The great slogan of the IFPH. I welcome all of you, Afghanistan colleagues, for participating in this 1000 celebration webinar by IFPH. I did non-stop webinars since last 1000 days. And this is a great, very, very great opportunity for the healthcare professionals, especially for the homeopaths, update their knowledge accordingly. And very respected healthcare professionals, distinguished guests, and warm regard from AHMA. I'm Dr. Ubaidullah Hashmi, the president of AHMA, Afghanistan Homeopathic Medical Association. And I'm extremely thankful to IFPH organizing team. And it is a great pleasure to participate in this 1000 webinar series celebration. And second day for Afghanistan is being mentioned by IFPH. The webinar series provide us the continuous homeopathic medical education, the updated homeopathic and scientific information, and given an opportunity to build a homeopathic professional skills development for the all healthcare professionals in a homeopathic field. And I heartily thank you to IFPH seniors, especially Dr. Ismail Syed, Dr. Shaji, and all his team for conducting and organizing such a wonderful and international programs for the development of the homeopathic skills of the homeopathic professionals. I think I'm not going to prolong my speech. Shaji, I think we have to start from our chief guest. And after the listening to the chief guest and our
I
guest
request
of
you to
honors,
introduce
I
the chief
will
guest.
say something in detail about the homeopathy in Afghanistan. Am I right, sir?
Yeah. You can introduce the chief guest of today, as you know them very well than myself. Please do that.
Yes. Let me introduce our chief guest of today. And this is, for the first time, we become able to bring such a great personalities to the homeopathic platform. And once again, I think 2 years ago, Dr. Hamid Shinwari, who has done his PhD in policy health.
Raji, there is some network problem, so please proceed. The next. You are muted.
The chief guests, we have two chief guests today. One is Dr. Ifph Shinwari, who is a former Director General of Afghan Medical Council, AMC, Government of Afghanistan. Sir, you are welcome here. We are proud to have you with us. And another chief guest is Engineer Rovin Sarvari from Germany, who is also connected to International Relations Coordinator of Afghan Homeopathic Medical Association. Both of you are welcome here. We are proud to have both of you with us. So one of you can have your guest lecture or speech to us, then followed by the other person. So I invite Dr. Ifph Shinwari.
I think Rowan Sarwari is joined. The other person is not joined.
Dr. Ifph Shinwari is here. Otherwise, Engineer Rovin Sarvari can begin this.
Yes, he is joined. Sir, please proceed.
Yes. Yeah. Please unmute and proceed.
Yeah.
Okay. Hello, venerable colleagues. There are some connection problem in Afghanistan. In this case, I know everyone knows this one. And I will start the procedure and we'll have an overview on our activities in Afghanistan. It's my immense pleasure to be here and have this opportunity to speak about Homeopathic Medical Association in Afghanistan. And at the beginning, because as a person which I'm working as a coordinator for this organization, before coming to this organization or making coordination with this organization, I have been working with several international humanitarian organizations. In this case, that experience led me to come here and work with Afghanistan Homeopathic Medical Association. And because of restriction of time, I will have a very short and brief description over our activities in Afghanistan and also our destination for the future and strategies. If everyone hear me so without any problem, then I will continue. If any problem, then I will stop and solve the problem. All of you hear me without any problem? I'm just waiting for confirmation. Confirm, then I will go ahead.
Please proceed.
Okay. Just maybe all of you will be in the picture that Afghanistan Homeopathic Medical Association, first founded by Dr. Ubaidullah Hashmi in 2018 in Afghanistan. And before that, I'm confident that nobody known about the homeopathic medical services around the world in Afghanistan, because it was the first time that this medical service introduced by someone in Afghanistan. And but during these years of activities, fortunately, we have tried to make some awareness services for the people about homeopathic services, and also making some coordination meetings with the government, because it was the first time that the government just knew about homeopathic services in Afghanistan. And fortunately, during this time, especially Dr. Ubaidullah Hashmi endeavored as much as possible. He made some close coordination with the government agencies, and also he tried to make some brief description about the Homeopathic Medical Association of Afghanistan with other medical associations in Afghanistan. But unfortunately, you're in the picture that after demolishing of the government in Afghanistan, we have lost much more of our experts and medical doctors, and they just all of them left the country. But one of the person which he always resists to stay in Afghanistan and work for medical services is Dr. Ubaidullah Hashmi, and because I mentioned it, be proud of him. And but we know we need to work much more in Afghanistan because it is new in Afghanistan. In this case, we made some planning and some stage of strategies that we want to implement, and we want to have these strategies for developing of Afghanistan with homeopathic medical associations. For the first, or for just making a temporary plan for us, that we want to make much more awareness session about homeopathic medical services in Afghanistan, and just we want to enhance our access to much more people in Afghanistan and make aware of them about these medical services, because it's very new in Afghanistan. It's our primary and temporary destination for our organization and association. Second, we just want to make an integration of homeopathic medical activities with the other health system in Afghanistan, because it is new, and integration is very important and essential for continuation of homeopathic activity in Afghanistan. And for a long term, we want to make some medical institutions, and because we want to train more medical doctors in homeopathic and also prepare some opportunities for the people and that they can learn homeopathic so professionally. And this is our long-term procedures that we want to develop, or we want to make a university or an institute for training of new doctors in homeopathic services. And maybe in this institute inside of medical services, which most of the students or most of the scholars which are learning in other medical universities, they can cover also part of homeopathic services in these institutes. And also as a as another destination and strategy we have currently, we want to make close coordination with the other homeopathic medical associations around the world, that if it is possible, they can prepare some opportunities for Afghan doctors, that they can go there and have some scholarships from other homeopathic medical institutes around the world, that currently we can prepare some scholarship for these doctors, and these doctors go there and learn homeopathic so professionally. Then this will support us for the future. When they come back to Afghanistan, we can also, inside of enhancing our activities, our homeopathic activities, we will also we can have them in our institute, in our university, because I'm confident there are a number of homeopathic doctors which do know homeopathic so professionally is very less in Afghanistan, and maybe we can count them in numbers. In this case, we need to have a close coordination with international institutes and universities, that if it's possible, we can prepare an opportunity for doctors in Afghanistan, that they will have study in that universities and learn homeopathic so professionally. Then in the long term, they will be so effective for Afghanistan and also for Afghanistan Homeopathic Medical Association. And I just don't want to make much more in here, because I know we have restricted of time, but just it was a brief description about our activities and also about our destination for the future. And I just want to take the turn to Dr. Obaidullah Hashmi or Dr. Shinwari. If you have some question regarding my presentation or description which I had, I'm here to answer it and also to have some discussion on your question.
Okay, Dr. Adi.
Yeah, Dr. Obaidullah, you know, you
Yes.
can introduce the next guest. If anything, please proceed.
Okay, our next guest, really sorry for inconvenience for this disconnection here. You know, this is the regular problem in Afghanistan. Our next guest of honor is Dr. Dr. Shafaq Shinwari. Shafaq Shinwari is the former Director General of Afghanistan Medical Council, Government of Afghanistan. And also he is the Vice President of Afghanistan Homeopathic Medical Association. He is doing his great efforts since 2018 for the promotion of homeopathy. He is a medical doctor, but he is trying the level best, more than his experience and his struggles for the promotion and integration of the homeopathic system in Afghanistan. I invite respected Dr. Shafaq Shinwari to present his speech. Thank you. Over to you, sir.
I think he's not joined.
Dr. Shinwari is here.
I don't know. I don't think.
If Dr. Shinwari is here, please go to the participant list and raise your hand so that we can make you the co-host.
No, no, doctor.
Sir, if Dr. Shinwari is not here, we will catch him later. And right now, I think it's better to invite Dr. Ehsanullah Ehsan and he is the guest of honor. He is a lecturer and a medical faculty in the government medical university, and he has done his family medical medicine specialist. He is also a rhythmologist. He is the president of the Afghanistan Family Medicine Association. And also Dr. Ehsanuddin Ehsan is the CEO of the Afghan Mercy Hospital, where I am working, and where I have my own OPD, and they are supporting the homeopathy since last 3-4 years whenever I know him. And he is the big supporter of the homeopathy, and he is a cardiologist, and also he is a family medicine specialist. I'm requesting respected Dr. Ehsanuddin Ehsan to present his presentation. Over to you, sir, please. Dr. Ehsan. Ehsan, this is the call of the church. As you are the witness, before I was disconnected, and you know, internet problems, sometimes disconnection occurs here in Afghanistan because we are living in a remote country, and this is the usual problem. But let's see, Dr. Ehsan is, I think, trying to get online, but what he's saying, just let me to listen him.
Sir, could you mind telling the hospital is not allowing you?
I think Dr. Ehsanuddin Ehsan, he trying to join, but he says the message occurs and say the host is not allowing you. I don't know what is the problem.
Please raise his hand. Please ask to raise his hand. You can identify him.
He's
Sir,
already
sir, please raise your
entered.
hand. Sir,
Open the
please raise
video.
your hand. Sir, please
Open
open
your
your
video.
video.
Yes.
Okay.
Yes.
Oh, okay.
Dr. Karim Tazangova. Karim.
Thanks.
Yes.
Am I audible?
Yes, sir. Yes, you are audible, sir.
Sorry for one thing, that here net connection is weak. If sometime I mute my video, so I will talk from audio, but we will see. So thanks from your nice introduction, Dr. Ubaidullah Hashmi. And also I want to present my special greeting in the form of Assalamu alaikum to my honorable guests, healthcare professionals, ladies and gentlemen. Dear participants, it is a great pleasure for me participating in such a big event, which is the 1000th webinar series celebration of Ifph International Forum for the Promoting of Homeopathy, whose this work is vital source for the promotion of evidence-based homeopathy updates. And I also again thank the Ifph for providing such an opportunities. I mean, these continuous homeopathy related webinar series through which updates and scientific informations can be shared among homeopathy related healthcare professionals. Ifph, through this webinar series, brought around 30 countries' healthcare professionals under one platform and one discussion table Therefore, I can say these activities are really admirable, particularly for the countries like Afghanistan and other developing countries. Now, if we shortly look into the history of homeopathy, as it was founded in the 18th century by German scholar, and fortunately, due to its specifications well progressed, currently I can say nearly 1 billion human in around 80 countries are benefited from homeopathy healthcare services. As I know, homeopathy healthcare services are cheaper, effective, and having less side effects. Therefore, I can say that these services and this education should be expanded. It should be available everywhere and for everyone. As I can say that homeopathy is relatively newer or having short history than allopathy, because therefore it is not well progressed yet in some countries like Afghanistan also. In our country, it is not yet organized, formally organized by Ministry of Higher Education and also by Ministry of Public Health. Here I can specially mention my brother named Dr. Ubaidullah Hashmi, who has done a lot day and night for the promotion of homeopathy in Afghanistan. As you know, in Afghanistan, healthcare services and medical education is provided by two ministries. Ministry of Higher Education mainly provide undergraduate education and also postgraduate education, which is, we can say here in Afghanistan, specialization and also master and PhD degrees. Ministry of Public Health mainly provides healthcare services and specialization in different specialties. As we know that as we mentioned also, in many countries, homeopathy is as a recognized healthcare service or system. But in Afghanistan, yet in none of the ministry it is recognized. Therefore, we need special support of member countries and your organizations to enter homeopathy system in these ministries also. As Ubaidullah Hashmi, president of Afghan Homeopathic Association, has done a lot, but yet is more to do to enter homeopathy also to the system, also to the medical education system, because in homeopathy also we have undergraduate education, postgraduate, master and PhD, and also they provide healthcare services. Therefore, we also need here in Afghanistan to enter all these into our education system and also in healthcare services system. In this regard, we need special support of member countries to support our AHMA, our organization, which is led by Dr. Ubaidullah Hashmi. So therefore, through these webinar series also we can share our information with one another, and also sometime we can go somewhere to these member countries to see their system face to face and to aware from them, and then bring it here in Afghanistan and convince our authorities in order to enter homeopathic system in Ministry of Higher Education and also in the Ministry of Public Health. So in this regard, again, I can say this, that we need your special support. At the end, I can say again, special thanks from organizing committee for such a valuable event because these webinar series is the main way of sharing experiences and education among the healthcare professionals related to homeopathy. And also, again, I thank from your organizing committee that you gave time for us and took our country in the second category to present our condition and to share our experiences and situations with you. So thanks a lot. If there is any question about my talk, so I'm here with you.
Dr. Baidullah, please proceed, unmute and proceed.
Not okay. Thank you, Dr. Ehsanuddin Ehsan. He is very great personality, and I really follow him, and I learned so many things from Dr. Ehsanuddin Ehsan, which professionally and personally. And next speaker, I think it's better that Dr. Ehsanuddin Ehsan will invite Dr. Zabihullah Umaid, and he is the most senior personality because he is the Director General of all Afghanistan Ministry of Public Health Universities teaching hospitals. He is the Director General. He is the most senior, and I gave this opportunity to Dr. Ehsanuddin Ehsan to invite Dr. Zabihullah Umaid. Over to you, Dr. Ehsanuddin Ehsan.
Thanks. Dr. Zabihullah Umaid, he's really a great personality, and he's really a great professional medical doctor. He has done his MD degree here from one of our university in Afghanistan. Now he's Director General of teaching hospitals which are related to Ministry of Higher Education. And he has done a lot for these hospitals because before healthcare services and also specialization and master degree, this curriculum and other this system were, they had some weakness and these things. So he did a lot for this. So I invite Dr. Zabihullah Umaid. He can talk on the behalf of Ministry of Higher Education and from his directorate to present what he has for our participants. Dr. Zabihullah Umaid.
Dr. Umaid, can you please raise your hand or open your video to identify you?
I think he's not joined on.
Dr. Baidullah, please check.
I think Dr. Ehsan, is it possible you could call to Dr. Zabi if he is not online yet? Please tell him to come online. Till date, we will not wait, we cannot wait more. We will pick him later if he is not still online, and we have to go to another participant. Dr. Ehsan, please answer.
Yes, I will call. You can proceed.
Then we go to Dr. Muhammad Kareem. Is there? Yes.
Yeah,
Ubaidullah?
Dr. Muhammad Kareem.
Yes.
I think Dr. Muhammad Kareem is online.
Yeah, yes.
Okay. Most welcome, Dr. Muhammad Kareem. Dr. Muhammad Kareem is also a medical doctor. He has done his MBBS. And also he is very expert in healthcare programs, public healthcare projects. And right now he is the project manager as one of the well-known non-profit organization, and he is also the public health advisor in Afghanistan Homeopathic Medical Association. He also, if trying to put his efforts for the promotion and regulation of homeopathy in Afghanistan. He is believer of homeopathy. He is a medical doctor, but he is willing to be a homeopath in future. This is a great thing. And in Afghanistan, so many doctors I have seen, they are interested to study homeopathy and they're converted to the homeopath, like Dr. Adil Chimtanawala. He is a cardiologist, but now he is a homeopath. And this is a great opportunity to have Dr. Muhammad Kareem. Please, over to you, sir. Dr. Muhammad Kareem.
Thank you, Dr. Ubaidullah Hashmi. Great speakers, host of this organizing committee for today's webinar, and all other colleagues from around the globe. I say my heartily welcome, assalamu alaikum, and greetings of the night. I will shortly say about Afghanistan Homeopathic Medical Association. How did it arise in Afghanistan? How did Dr. Ubaid started this project for the betterment or improvement of healthcare services, especially the second line system in Afghanistan, which is being recognized by the WHO and other entities. Dr. Ubaid started its project, you have to say that from nothing, and now he did a lot. And my other colleagues said a lot of things regarding this. So I have just to briefly say that he did a great job, and for the improvement of healthcare programs and other services through this type of system, which was not being well known before, as Dr. Ehsan mentioned. And I joined the AHMA being a member since 2019 till now. And if you, I think Dr. Shaji and Dr. Manoj and other colleagues remember that I think last year, in 2021, I presented a presentation from Afghanistan side along with Bob Lim. He was from Malaysia, and one of our, I think, professor, I didn't remember the name of her, but she was from India, and the ma'am. So I mentioned at that time, like Dr. Ehsan and other colleagues forced upon this, that we need cooperation from member countries who are working in homeopathy. So we need that they have to support us in education system and regarding scholarships, many other opportunities for our Afghan youngsters who are willing to come to this program to serve the humanity in a deemed way. So I think I have no more comments and no more speech regarding this, but this is my request from all of you that you have to support AHMA, Dr. Ubaid and other colleagues who are running this project with nothing till now, because all of you know the situation very well. So we need your support at utmost times. So it will be great that for future we are having more opportunities regarding this program to support our healthcare system along with allopathic, because now people are understanding what kind of system is this, because this is a cheap system which can provide healthcare services at a very low cost, and everyone can access as compared to other systems. So it will be your honor and your support that you have to support us for future timings, and we are very grateful for your honorable support. And I think now it's over. Dr. Ubaid, are you agree?
Yes, thank you so much, Dr. Muhammad Kareem. Dr. Muhammad Kareem is always energetic person. When I see and meet him, I get more energy to work more and more for the homeopathy in my personal life. But once again, I thank you, Dr. Muhammad Kareem. He is very busy person. He is working in health projects. They are working in all over the Afghanistan to providing the public health and some other programs to make the people healthy within the Afghanistan. He is well qualified, and he has got some more and more international conferences, and we need him. And I request Dr. Muhammad Karim, don't let us alone. And I hope we will have a very great future with homeopathy in Afghanistan. Thank you, sir.
Sure. Sorry, I'm cutting you. Thanks a lot because you did a lot. You said a lot, and I'm nothing like that. But I will try my best to work further because right now I'm working with a national NGO. Like Dr. Obaid mentioned, that we are working in health sector from primary to tertiary care setups around the Afghanistan.
Okay. Dr. Abedullah, please invite the next person.
Yes. Next person. Once again, thank you, Dr. Muhammad Karim. The next speaker will be Dr. Muhammad Azim. He has done his MBBS from India, and he is the medical doctor of emergency unit in Afghan Mercy Hospital, Kabul, Afghanistan, one of the best hospital in Afghanistan. I think he is the emergency unit chief. Unfortunately, some emergency cases is being presented right now, and I think he has went to the emergency unit. I think he may not be able to participate because he has some few emergency patients and he has to be there. And right now I have to go to Dr. Shafaq Shinwari. Dr. Shafaq Shinwari, if you can hear to me, please raise your hand. It's your turn. He is our chief guest, and also he is the former medical Director General of the Afghanistan Medical Council, one of the health regulatory authority in Afghanistan. This organization is more authority and more responsible than the Ministry of Public Health and Ministry of Higher Education. This is very important organization. He is the ex-Director General, and also he is the Vice President of Afghanistan Homeopathic Medical Association. Thank you so much, Dr. Shafaq Shinwari, for being with us in this special occasion of IFPH 1000 webinar series celebration. If you can hear to me, please.
Yes.
Just over to you, Dr. Shafaq Shinwari. Please raise your hand.
Yes, he's there. Dr. Shafaq, please proceed.
Yes, he is there.
Yeah.
Thank you. Thank you very much that having the great professional personalities around the world of the one of the greatest profession of
Dr. Shafaq Shinwari, if you hear to me, please change your location. The signal is dropping. We cannot hear you, sir.
From the world, and from the Afghanistan, especially in the health sector and in the education sector. Unfortunately,
Again, some network problem, unfortunate. Okay. Dr. Abedullah. Dr. Ikram, can I stand?
Yes, I think internet problem here because Dr. Shafaq Shinwari, not he, but everyone, we feel this problem, sir.
Yes.
And right now, I think one of the best our colleague and our friend and homeopath, Dr. Ikram Khan. Dr. Ikram Khan is, he is online from Pakistan. He is very great personality. I really love him. He is very gentleman and very talented, according to the homeopathic curative side. And please allow him to talk very and briefly and shortly, sir.
Yes, please, Africa.
Thank you so much for inviting me here. Can you listen me, please?
Yes, yes, please proceed.
Thank you so much for inviting me here among such a great doctors. And you know, homeopathy is like a homeopath. We like a family. And whenever I get chance to talk homeopath, and I feel very good. Thank you so much. Almost 5 to 6 months ago, I visited Afghanistan because one of my patient invite me there to visit and see patients, because so many patients visit here in Pakistan. By the way, I am living nowadays in Pakistan, but my forefathers belong to Afghanistan, and I am Afghani. And so many people, mashallah, talking about my country, and I am very glad to listen you people. Thank you so much. So I met Dr. Hashmi in Kabul. Before meeting with Dr. Hashmi, Ubaidullah Hashmi, I met few homeopathic doctors, but I was not satisfied. When you met with some homeopath, you know, you have pleasing in your effect in your heart. But when I met Dr. Hashmi, I think there is one-man army and full-time thinking and talking about how to promote homeopathy in such country when there is no recognition, formal recognition of homeopathy. And that was very golden time for me as someone working for homeopathy in Afghanistan. Thank you so much for Ubaidullah Hashmi, who is working from the core of heart for promotion of homeopathy. Actually, he wants the ministry like Ayush Ministry of India. As we know, I have so many teachers from India, and I learn a lot of things from them, like Goran Gakved and the late Dr. Praful Vijakar. You can call him the Einstein of homeopathy. And after getting so much online courses, I come to know that the homeopathy is just can be survived with results, with cures. And mashallah, Dr. Hashmi doing practice there. I visit there near Russian embassy in Kabul, the capital of Afghanistan. And inshallah, one day we will we will listen by someone, or maybe I visit also there again to meet him to promote homeopathy. If there is any,
most welcome anytime.
Yes, thank you so much. Thank
Anytime
you so much.
visit Afghanistan, we are here.
Thank you so
We
much.
are here. Thank you so much. Yes, thank you so much for being with us. And you had a very beautiful words for Afghanistan, not for me. I'm nothing. I'm just servant of the people, just for a servant of homeopathy. Thank you so much, colleagues. Now I think the last turn, we come to the Mariam Latifi. She is one of the homeopathic promoter. She is the General Secretary of Afghanistan Homeopathic Medical Association, and she also the Deputy Director of the RSO. RSO is one of the NGO. She is the Deputy Director and working in the open empowerment at that organization. And she is a homeopathic lover and homeopathic promoter. Just over to you, Mariam Latifi, please.
Maria Hashmi? Dr. Ubaidullah. Yes, yes. He's there.
Bismillahirrahmanirrahim. Am I audible, sir?
Yes.
Salam to all, respected colleagues and dear guests from warm regards from Afghanistan. I am very thankful to the IFPH for your kind invitation. This is a great pleasure to participate in the 1000th webinar series celebration. Afghanistan is very indeed for homeopathy to integrate with government of Afghanistan as soon as possible. As the Secretary of HME, we have achieved so many goals, but unfortunately, still we could not regulate the homeopathy with our healthcare system, government of Afghanistan. I request to all homeopaths to help Afghanistan on this regards. Once again, thank you IFPH and his team. Thank you, Dr. Ubaidullah Hashmi. Have a great time. Good night. Thank you so much.
Thank you, Mariam Latif, for being with us. And you had very, she is very talented. She is trying the best to participate in each and every event of the homeopathy. Thank you so much. Over to you, Dr. Shaji, please. We have to listen to you.
So thank you. Thank you. You arranged very nicely and brought a lot of important people in Afghanistan to bring homeopathy to the better heights so that the people of Afghanistan will be definitely benefited and homeopathy become one of the mainstream medicines in Afghanistan very soon. I definitely believe in India as your neighbor, and we are neighbors, and we will be able to definitely help from government to government side and people to people side also to support each other so that we become good neighbors and support each other in helping each other. We need to develop the spirit of human brotherhood, and that will be the future of the world emerging. So we all become global citizens and human brotherhood in future, very near future, where we will be all helping each other and supporting each other to live happily, comfortably, peacefully, and healthily. So with that vision, I thank all the team of IFPH Afghanistan in the leadership of Ubaidullah Hashmi and all the team and others joined. I thank you all from the bottom of the heart on my personal behalf and on the behalf of International Forum for Promoting Homeopathy. Thank you very much. Keep in touch. See you all. For your any needs, our support will be there with the full heart and love and care. Thank you.
Yes, with that, we conclude today's session. Hope you will see you tomorrow. Till then, goodbye. And his order to Thanesh for a continuation of program.
Thank you, IFPH.
Yes. Yes, Dr. Ubaidullah, please continue to participate in our program. Thank you.
Absolutely. Thank you, IFPH. Thank you, participants. Thank you, our chief guest. Thank you, all homeopaths. And thank you, homeopathic lovers, students, patients, everyone. God bless everyone. Thank you.